Hello, and welcome to the 12th episode of the webinar series on global crisis, global risk, and global consequences from the Geneva Center for Security Policy, GCSP. The GCSP is an international nonprofit foundation physically based in Geneva, Switzerland, comprised of 53 states, of which all permanent member of the UN Security Council. My name is Marc Rickli. I'm the head of Global Risk and Resilience at the GCSP. The GCSP mission is to promote peace and international security, to prepare and transform individuals and organizations so they can create a safer world. We are impartial, independent, and inclusive. We achieve our objective through executive education, research, public discussion, as well as innovative fellowship program for executive in transition. Our community has grown significantly over the last few years and now reached more than 8,200 influential alumni around 165 nations. When we started this webinar series 12 weeks ago, coronavirus was approaching 1 million infections worldwide, and there were almost 48,000 deaths. This week, we have more than 8.3 million infections, which is more than 8.4 times what we had 12 weeks ago, and more than 449,000 deaths worldwide, which is more than 9.35 than 12 weeks ago, of which more than 117,000 deaths in the United States. As you can see, the coronavirus is far from slowing down, and it's continuing its growth worldwide. But the growth has shifted from Europe to the United States to now South and Latin America. And maybe in the future, we'll see a growth in Africa. At least it's the topic of today, about looking at the impact of the COVID-19 on Africa. We have a very distinguished panel today to discuss the impact of the COVID-19 in Africa. First, we'll have Dr. John Ngengasong. He's the director of the Africa Center for Disease Control and Prevention, a very important organization in Africa, the leading organization dealing with the coronavirus crisis. He will talk about the overview of the public health impact of COVID-19 on Africa and the continent response. Then we'll have Dr. Gervais Ruffikiri. He's a former vice president of Burundi and is now GCSP executive in residence fellow. He will talk about reflections of COVID-19 and Burundi. Then we'll have Ms. Mausi Shigun. She's the executive director of Human Rights Watch Africa Division. She will talk about recent human rights and governance impact of COVID-19 on Africa. Then we'll have Ms. Susan Stigant. She's director of the Africa programs at the United States Institute of Peace in Washington. She will talk about forward-looking impact of COVID-19 on economies and society. And then last but not least, Ms. Ralph Mamia. He is a GCSP executive in residence fellow, as well as non-resident advisor to the International Peace Institute and a former UN Department for Peacekeeping Operation civil servant. He will talk about potential ways to find opportunities in crisis. Last week, during a session on Latin America, we realized that, as I mentioned earlier, the center of gravity of the spread of coronavirus has shifted now to emerging economies. When we look, though, at Africa, Africa looks like an exception because it has been so far relatively immune from the coronavirus. Africa reported its first case of the novel coronavirus on February 15, a full 2 months after it was first identified in China. As of June 18, according to the Africa Center for Disease Control and Prevention, there are 267,519 cases, 7,197 deaths, and 122,661 recoveries in Africa. According to the Africa Center for Strategic Studies, the coronavirus has been now reported in all 54 countries in Africa. 10 countries in Africa are currently responsible for nearly 80% of all infection, with 70% of death taking place in only 5 countries: Algeria, Egypt, Nigeria, South Africa, and Sudan. The slow rate of the dissemination of the coronavirus is linked to a host of factors. The early spread of the pandemic in many African countries was driven by foreigners and the economic elite, people from Europe and those with the means to travel to Europe. Most African nations staved off the initial spread of the virus for several months, partly by closing early their borders, banning public gathering, and in some countries, effectively tracing contact using past experiences of infectious disease. South Africa led the way by closing its border to high-risk travelers and shutting its schools in mid-March before reaching 100 confirmed cases. A strict lockdown was then swiftly imposed. Health experts say that this tough decision and the long experience dealing with the diseases like Ebola and yellow fever made a significant impact on transmission rates. Other key factors are relative to the movements of population across the continent, with sparse road networks and largely rural population in some regions. The virus may have fewer opportunities to travel. Climatic factors like weather and precipitation could also have played a role. One clear advantage across Africa is based on the makeup of the population itself. More than 70% of people living in sub-Saharan Africa are under 30, and we know that the coronavirus is affecting elderly more severely. Lifestyle conditions also, such as diabetes, hypertension, and obesity, which are important comorbidities for the coronavirus, also led to fewer severe cases in many African countries. So if we look at that, Africa managed to deal quite well with the crisis at the beginning. It took 98 days for Africa to have 100,000 confirmed cases. Yet, the World Health Organization said last week that confirmed cases in Africa has doubled in 18 days to reach now more than 200,000 cases. Even though these cases in Africa account for less than 3% of the global total, it is clear that this pandemic is accelerating. To make the matter worse, testing is still extremely limited in most African countries, so it is impossible to know how widely the pandemic has taken hold. And now that many African countries, like others across the globe, are lifting the restriction in order to restart the economies, the virus has the opportunity to spread and potentially to overwhelm healthcare system characterized by a shortage of protective equipment and healthcare professionals. Economic impacts will probably follow due to the prioritization of national expenditure towards controlling COVID-19 and affecting allocation of resources to other sectors. Tourism is also heavily impacted. Remittances will have a critical impact on a monetary system and household consumption. The reduced flows of hard currencies and the ability of households to purchase essential commodities will also be impacting, as well as the global impact for recessionary trends at the global level, and the potential for a prolonged reduction of economic growth in China will also have a direct impact on Africa.